If you've had problems with shoulder issues and they keep coming back, today's video is for you. I'm Dr. Gregg Gerstin with Align Wellness Center, and I help people to remove the blockages in their health so they can lead amazing, fantastic lives. So the shoulder is a really dynamic joint. By the way, if you've got shoulder issues and you like this, go ahead and smash the subscribe button. We're constantly producing content like this to help you live an amazing, fantastic life. But the shoulder is a really complex joint. You see, it's not very stable, but it's very strong. It's got a lot of motion, however, it's not very stable. The humerus that winds up sitting on your shoulder just barely sits on it, and then it's held in place primarily by a group of muscles. Big ones like the deltoid, and then smaller ones like the rotator cuff. However, when the shoulder as a whole gets shifted in position on your torso, so it should be way out to the side, that's where it's designed to be so that we can stand upright and it can have the best mechanical advantage for these muscles so that they can wind up depressing the shoulder head to begin, allowing for a reduction of your shoulder to go up all the way to the sky without any pain or problem. However, when the shoulder winds up shifting positions, and typically this is a postural distortion, in that as we shift our pelvis back, our torso back, the shoulders wind up rolling forward. You guys have seen it, now you're going to notice it on your body. When we're in this position, the shoulder has to work totally differently to move the head of the shoulder down so that it can get way above your head. With this change in the mechanics of the shoulder joint, the muscles are used differently, and they can wear down and break down prematurely and easy. If we just go in and do shoulder rehab for this, then we'll never wind up getting the problem corrected, and we'll wind up managing the symptoms with either physical therapy or injections to manage the inflammation, and we'll progress down the road until we need to have a rotator cuff surgery or a shoulder reconstruction. And then even in those cases, they're very frequently failed, in that within 6 to 8 months, the problems are right back. The reason those problems wind up coming back is that the shoulder's position on the torso is incorrect. So fixing the shoulder, if it's in the wrong place, is kind of like if you've got an axle in your car that's off alignment, but you just replace the tires. In replacing the tires, you'll have great new tread, but you'll run through that tread very quickly. If we don't wind up changing the position of the shoulder on the torso, then we'll never get that corrected. And the position of the shoulder on the torso gets controlled by our overall posture. Now we look at posture from the side, we should see that the hips are right below the ankle, that the shoulder, or actually the torso, should be right below the hips, and then the skull should be right below the shoulder. If that's not the case, you've got to work with someone that can understand how these changes in positions happen, and that's a corrective chiropractor. If you've never worked with one, go ahead and type down below. I'll do my best to find someone in your area. If you've got more concerns about your condition, write them down below. I usually answer them, and we may have to jump onto a discovery call to figure out your concerns and get you into the right next steps. But these steps will really help you to understand why this shoulder has never truly gotten better. If you've got more questions, write them down below. I love your comments, and they help me to create future content. Once again, my name is Dr. Gregg Gerstin, and thank you for letting me be a part of your health.